Hello, everyone. I'm Dr. Erwin Martinez, your lecturer in Pharmacy Department, San Pedro College, and also the visiting professor of Bournemouth University, United Kingdom. Welcome to our topic number 2 on the introduction to medication review. So our objective for today is to describe medication review, and number 2 would be to identify and describe the components of a case plan and a follow-up evaluation. In the medication review, we always adopt with what we call as pharmaceutical care. And as we all know, pharmaceutical care already adopted for a long time ago with 2 decades already, which have gained widespread acceptance then for the pharmacy profession. At the same time also, pharmaceutical care described as what the patient is intended to receive, the care which emphasize on the prevention, on preventing deterioration by maintenance of control of a condition rather than on responding to a crisis. It also provides a concise definition of what pharmacists are doing, example, using their close patient contact to monitor the effects of medication and to provide safeguard to help doctors and patients obtain the best possible result from the drug therapy. So in the medication review, we always try to adopt pharmaceutical care because our main goal is that to be able to prevent, at the same time also maintain in terms of control of a certain condition of our client or our patient then. And of course, to be able to provide the safeguard to help our clinicians, our patient then, to obtain the best possible outcome of drug therapy. Now, what is all about pharmaceutical care and how it is actually important? As we all know, it is important because at this time, we have multiple prescribers of medication for a single patient. There are also explosion of drug products and drug information in the market and increasing complexities of a lot of medications, and that would result also to polypharmacy of patients. And there are significant level of drug related mortality and morbidity and the high human and financial costs of drug misadventure, recognition of a social need to address drug related problem. And pharmaceutical care is very important because as we all know in the world, no, in our healthcare system per se, there are a lot of patients which taking a lot of medication with a lot of comorbidities or comortalities then. And as we all know that there's a lot of medications already in the market which a pharmacist need to address, especially in terms of drug-related problems, adverse drug reactions, and a lot more. As we all know also, there are a lot of primary responsibilities of a pharmacist then. And these are the responsibilities to ensure patient drug therapy is safe, effective, and efficient, to identify, resolve, and prevent any drug-related problems, and to ensure that the patient therapeutic goals are met and optimal health-related outcomes are attained. So in these primary responsibilities of a pharmacist, the main goal should be addressed to make it sure that the drug is effective, safe, and quality for our patient. And we'll be able to resolve all these phenomena then of drug-related problems. We'll be able to identify it using medication review, resolve certain problems because we're gonna have some inputs then to our doctors and other healthcare providers. We'll be able to resolve, we'll be able to actually have recommendations then to our healthcare provider. That is why we'll be able to prevent such drug-related problems. Now, there are certain primary responsibilities then of a pharmacist, aside from what I've mentioned. Number one would be the responsible provision then of drug treatment. And as we all know, in the drug treatment, there are a lot of complicated processes that involve different parties. Example would be the relationship then of pharmacists, doctors, and other healthcare providers, especially our nurses. So there may be complication then relating to the drug therapy of our patient. And higher levels of care for individual patients, there is really a need to clarify the respective responsibilities of different healthcare providers. Because of these complex processes, then there are need to have unmenable controls then of the provisions of care for our certain patient. Now, number two would be in terms of definite outcomes. What to be in terms of the goal of our drug therapy that requires in terms of assessment to achieve certain kind of expectations or goal to our patient and also to our healthcare providers. And we'll be able to assess this against our definite goal then. For instance, the symptoms and how they're being relieved, the goal in terms of lifestyle medications of our patient, the diseases they have, and we'll be able to increase also a better ways of measuring and recording such clinical outcomes then. So in the definite outcomes, we'll be able to assess if we are really into that goal by assessing using our medication review. Now, as we go along with our definition then of what is medication review, at the same time also we'll be able to identify what is really the goal. The goal that we are expecting is the improvement in terms of its quality of life. They be able to conduct their normal life. They be able to have the important parameters then in terms of their the quality in terms of the living conditions that they have, the living improvement then of their life. No? So they be able to go on to their normal life. They may actually go to the normal cinema. They may actually go into walking, dating with their loved one, and the normal routines that they have, especially their household chores. No? And we'll be able to actually monitor then this important patient, no? So that we'll be able to assess, no, the quality of life that they have, and we'll be able to measure the endpoint in terms of their drug treatment. And sometimes these medications that they have, they may actually improve in terms of the quality of life, but how about in terms of the adverse reactions or the side effect associated with this particular drug? No? So it is very important to have these evidences, no? The impact in terms of the care of the things that matter to that particular individual patient. Now, moving on, there are also other services for that particular patient. We may actually adopt with therapeutic drug monitoring, pharmacokinetic dosing, drug information, patient education, and we'll be able to assess in terms of how to prevent from drug misadventure, drug-related morbidity and mortality. No? We'll be able to assess and we'll be able to contribute as a pharmacist then not only in terms of the quality of life, but also in terms of drug-related problems. And in the drug therapy, the main objective is that we be able to be cured. Number two is that they be able to reduce or eliminate such symptoms they have, like fever, nausea, vomiting, dizziness that they have. At the same time, also slow down disease progression, like for example, in terms of cancer and other burden diseases. At the same time, also the prevention. The main outcome of drug therapy is that they be able to increase in terms of patient quality of life and well-being and increase work productivity. And of course, the most important one also is that they be able to save in terms of the cost, especially in terms of the length of stay in the hospital, in terms of the complexities of drug medications, polypharmacy then, and all, which we may assess if it is really appropriate or not in terms of the treatment. Now, moving on to drug therapy, we'll be able to screen and secure in terms of the best result in terms of drug therapy. And we'll be able to also receive the patient in terms of necessary medications that they have and eliminate in terms of inappropriate or unnecessary medications that they are actually taken. And there are some decisions of drug therapy that to be able to start, discontinue, change, or continue with a certain drug therapy that are frequently made under circumstances in which the patient is not fully involved or informed. So we be able to actually inform our patient because they have the right in terms of information. They be able to be part in terms of our decision, in terms of their health. We be able to empower them, in terms of their diseases, or if there is in terms of their medication then. And decisions are not always followed then by same practitioner, particularly when the care of the patient transfer between other medical professionals. So if ever there are also other doctors, there may be actually also another decision then of another medical doctor or another healthcare professional then. At the same time, also in the drug therapy, the optimization concept of meeting an individual particular needs. So I think that is the main outcome then that we need in terms of drug treatment or drug therapy then, that to be able to address in terms of the need of our client, and empower them in terms of their medication. And we be able to empower them and be able to commit and ensure the continuity in terms of the decision that they have, especially with our patient, our healthcare providers, that we be able to monitor in terms of the patient's progress to attain in terms of the drug goal, the goal of the goal of our decision of our treatment then. At the same time, in drug therapy, the optimization then of our medication would really matters also, no? If it is really appropriate or inappropriate, then we'll be able to identify, no? And in the rational drug use, we'll be able to optimize then the patient, the particular medication of our patient then, that would it deliver then into our goal? Would it actually address in terms of the need of our patient then? Okay, so the goal of the drug therapy need to be clear to our patient, in our healthcare providers then, and we'll be able to eliminate such errors and risks to our patient, those unwanted side effects or suboptimal drug therapies that can be given to our patient. And that would actually result such underlying conditions and like for example, side effects associated with the drug that will add up to the cost of our patient. And systematically, we be able to have a correct decision in terms of our selection, use, monitoring of the medicines that are necessary to safeguard the interests of the patient, the prescriber, and also the pharmacist. So next would be in terms of the drug-related problem. I think this is the core program of our medication review. We'll be able to assess then those undesirable events that experienced by our patient involving all our drug therapies. Now that interfere with the desired patient outcome or our goal then. Okay? So some of the examples that we have, like the drug therapy indicated or needed but not prescribed, patient not taken or receiving drug prescribed or non-compliance. We have also taking or receiving wrong drug, taking or receiving drug for which there is no longer any valid indication, taking or receiving too little or of a correct drug or underdose. We have taking or receiving too much correct drug that may be overdose, or experiencing adverse drug reaction and experiencing drug-drug or drug-food interaction and more. So in these drug-related problems, it can be also relating to inappropriate prescribing, such as inappropriate in terms of the drug, dosing interval, route of administration, treatment duration, frequency, and of course, the regimen. And also in unavailable of a particular drug, like example, out of stock, which result into some of the non-compliance of the medication, especially also affordability of the patient, and also other factors, like for example, sociological, it becomes a burden to the patient, or a particular patient who have a stigma, and other biopharmaceutical factors. So in the drug-related problems, there are also dispensing error, which related into the labeling, wrong advice to our patient then. In terms of patient behavior would be compliance with inappropriate regimen, non-compliance with appropriate regimen, idiosyncrasy, which may relate into a differences of genetic makeup of an individual on the response to a particular drug, or a mistake or an accident of taking with the wrong drug. So another one would be in terms of monitoring, wherein there is really a failure to detect and resolve inappropriate therapy then and effects on the certain patient. And this is how we actually, we already discussed about some of the drug related problems then, and of course the relating to drug therapy then, how we be able to actually resolve such drug related problems. So this particular pharmaceutical care plan is actually our advice then to healthcare providers and also to our patient then. So this is actually our plan, our schedule then. We'll be able to actually advise the patient, we'll be able to monitor the patient and identify certain issues, concern of the patient, and what would be our appropriate action or advice then, or a particular plan not to the patient, and what would be the certain outcome then of this particular pharmaceutical care plan. So number one, in constructing with your pharmaceutical care plan, is to be able to identify certain pharmaceutical care issues. What would be some of the medical related problems that experienced by your patient? Example would be uncontrollable blood pressure, irregular home glucose monitoring, non-compliance to diet, and more. And some of the drug-related problems that we have, such as inappropriate choice of medicine, wrong dose, wrong frequency, wrong drug administration, potential drug interactions, adverse drug effect, non-compliance to medication, and others. After you've already identified such issues then, what would be some of the priorities of all the issues that have been identified that is relating to the quality of life? At the same time, the priority then, if what would be some of the advice that you be given to your client or your particular prescriber then. So you need to identify them in order of that particular prioritization. At the same time, also number three would be to determine the action to be taken then. After you have identified the issues then, the priority then, you'll be able to have certain interventions or actions then to be given for that. Like for example, what are you going to do if there is an uncontrollable blood pressure? How you be able to monitor your patient then and achieve the outcome or the desire or the goal that you want to have. Another one would be, after you've already identified the action, would be to record the action taken. After you have already record the action taken, then you'll be able to identify what would be the outcome of the action taken then. So that would be in the construction of your PCP. Now, moving on to this, in the pharmaceutical care process, we be able to actually initiate relationship with our patient or caregiver. Why? Because in the pharmaceutical process, when we're getting with the data, we be able to actually need to establish so that the patient will actually divulge or give you a shall we say, issues in concern, so that the patient will be open up to you on a certain problems that they have experienced with regards to the medication, or a particular disease then, or adverse drug reaction or side effect of a particular drug given. After you've already built a relationship, you'll be able to gather patient information, whether it is subjective, okay, the signs and symptoms then, the objective based on the laboratory and the evidences that they have, and you'll be able to assess the information, the patient assessment then, and you'll be able, after you have already assessed the information, you'll be able to actually develop a particular pharmaceutical care plan. After you have already developed the pharmaceutical care plan, you'll be able to complete the intervention and what to be some of your intervention or plan, no? After you have already developed such care plan. And then after you develop your intervention, you'll be able to implement a follow-up to your patient. Okay, so that would be the process that we usually do once it is in dealing with patient to have this kind of medication review. So in the medication review, you'll be able to look into the history of your patient then, and what are some of the issues pertaining to the medication, to the diseases, no, to the particular drug, no, that was given. Now, what usually we do in the patient assessment? In the patient assessment, the pharmacist actually evaluate them on the given information, subjective or objective. And that is by gathering all the patient information, the medical record, the drug chart, and make the necessary decision and appropriate decision on that particular evaluation or assessment then. So the evaluation will look into a particular decision regarding the health status of your patient, the laboratory result of your patient, the drug therapy needs and problems, the intervention, and of course the follow-up, the monitoring for our patient. And how was the physical assessment then? Is it really aggravating in terms of the laboratory result? All of it are high, some of it will be low. And the objective in terms of the patient assessment to identify if there's really a need in terms of intervention of that particular issue, particularly if there's lowering in terms of potassium level, increasing of the blood pressure, and whatsoever, no? And the care issues must be priorities then, no? In terms of urgency, in terms of the less critical, then you'll be able to evaluate it, okay? At the same time also, the care action or the intervention would include, no, relating into drug-related problems, preventions of any issues pertaining to the drug, and be able to resolve it, including of which the intervention can be educating and counseling our patient, contacting other healthcare professionals, making recommendation about drug therapy, referring patient to other healthcare providers, especially to the medical doctors, and we'll be able to involve also monitoring of a certain care plan. Now, in this care plan, we'll be able to follow up, and that follow up includes the monitoring in terms of the contact now of patient to evaluate the compliance or side effect of a particular drug. At the same time, also the measuring of the vital signs or checking with other physical or laboratory data then. So in this follow-up is very important because we try to reassess if our intervention is really effective or not. We'll be able to evaluate then the appropriateness of our medications, appropriateness in terms of intervention, and what needs to be done. So if there will be similar issues then throughout the particular months of taking the medication, we'll be able to actually assess, evaluate them, and we may actually have another interventions that be given then to our certain patient or our client. At the same time also, we'll be able to document in all necessary evaluations and assessment to be done. There should be a record because as what they said, what is not written is not done. Okay? There should be a proven evidences that there was an intervention, that there was a goal that needs to be achieved for a particular patient then. Okay? So this particular documentation can be SOAP format or FARM or FARM format, or it can also be an IAO or Care Issues Action Outcome format, which gonna be discussed later on. This documentation can be also the SOAP format, which S stands for subjective, which usually given by the patient or caregivers in terms of their complaints, the history of presenting illness, the past medical history, the medication history, the allergy, and the social and family history there. And when we say objective, these are actually measured objectively, wherein you can actually have it as a vital signs, physical findings, laboratory result, serum drug concentration, the ECG, the chest X-ray, the biopsy, the medication chart, the profiles, and all that are very objectives. No? It can be done in the laboratory and all. No? So these are really an objective evidences that one is a assessment which looks into the medical problems, the diagnosis, the drug-related problems, the medical effect, the progression of your certain ailments or a particular disease or a particular signs and symptoms, and to be the letter P, the plan then, in terms of stopping or addressing to stop medication. And some modifications then of a drug, the dosage, the frequencies, no? Adjustment in terms of intervals, monitoring, communication with patient and other healthcare providers, and of course, the counseling of your certain patient then. And another documentation would be in terms of the format, no, of FARM. FARM is actually similarities with SOAP, but this is more into findings, assessment, resolution, or what to be your intervention, and what to be the monitoring or the outcome that you want to achieve or the assessment. Now, in the IAO, which all of us are quite very convenient of this, I usually adopt this one in Malaysia, the IAO, which means meaning to be able to identify certain care issues, which are similar with SOAP and includes drug-related problems, the condition-based as well as in terms of the particular review of the medical doctors, particularly on the treatment of a certain disease, like for example, hypertension. And we have A, which is action. This is actually our intervention then given to a particular patient. At the same time, also letter O, which means an outcome. This documents in terms of what to be the goal then of the patient and have we achieved that particular goal carried out by a particular intervention or a particular action then. Now, moving on to this, we say that this is an example of an IAO format. And an IAO format, which are quite very easy in comparison with other documentation, it mentioned here the particular date wherein you actually found out that documentation or you found out that kind of a problem or issues of a particular patient. And then a particular care issues then, example, would be to review in the treatment of hypertension. The blood pressure is 112/70 and the heart rate is 48, which causes about bradycardia. And the patient have lightheadedness, no? Headedness. So, and of course, the action would be in relation to the care issues would be to check if the patient is compliant with the medication because as we all know that the drug may have may not actually have an effect or if the patient may have a particular problem in terms of compliance with the medication. No? So if checking with the compliance, the outcome of this would be the patient is taking atenolol, one tablet twice a day instead of an OD. That's why the patient having hypo, no? hypotension instead of quite lowering in terms of the hypertension because of the overdosing of the medication, which is your atenolol. One tablet supposed to be BD, instead of OD, it becomes BD then, as prescribed. So, and it was mentioned also here in the care issues, a particular time and date is necessary then because that is a time wherein you identify certain issues or problems. And it was mentioned also here that the patient has taken more drug, the atenolol, than necessary. That's one of the another problem, aside from the complaints of bradycardia and lightheadedness. So in that case, you'll be able to counsel the patient and be able to inform the doctor that there was a overdose of a certain medication as prescribed. And the patient has been counseled and doctor has been informed regarding a certain so anything that you have actually monitored, or have you told the patient then, have you counseled the patient, have you informed the doctor regarding anything that you have done, must be into your action. And what is really the outcome then? That you have already informed the doctor, you have counseled the patient, you have already discontinued the medication or whatsoever. No? So that must be included then in a particular action and actually in the outcome. Now let's try to summarize then what we have learned. In the summary of our pharmaceutical process, we have learned that assessment is very crucial then to ensure that all drug therapy is indicated so that it may be have an effective, safe, and convenient for our client. We'll be able to assess also that is there any drug-related problem associated with this particular drug or the treatment regimen that the patient is actually having. At the same time also, the care plan. These are the interventions that you have after a certain assessment, whether it is subjective or objective then, and we'll be able to actually resolve certain drug-related problems and be able to achieve a certain goal, a therapeutic goal, and we'll be able to prevent such drug-related problems then. So within your assessment and care plan, you'll be able to document it until you will have evaluation or the outcome of this particular interventions that you have. You'll be able to record the actual patient outcome then. Like for example, the blood pressure, the glucose, no, monitoring of the patient, and you'll be able to evaluate the progress. If we have achieved the goal then of our patient then, and we'll be able to reassess the new problems of our patient. Along the way with the assessment, care plan, evaluation, or the IAO then, the intervention, the assessment, the action then, at the same time in terms of the outcome of our patient, we'll be able to document all of this throughout the end of our throughout the end of our patient in the hospital or into the clinic. Okay, so these are the challenges of pharmaceutical care. To be able to update always our knowledge and our skills, and we be able to always communicate with our patient and doctors. These are really a practice for all of us. No? At the same time, also you'll be able to have time management because there may be patient that needs to have proper intervention, and you have another set of patient and another set of patient. We'll be able to cater all. We'll be able to have this kind of time management then. And what to be the necessary, what for an intervention of a certain patient. Okay, I think that's one of the challenges in pharmaceutical care, especially in the hospitals in the Philippines, wherein it is really a great burden in this time of COVID-19 pandemic. Okay, so it is really an eye-opener for all of us. These challenges that we need really to have this kind of intervention, especially in our pharmacy practice. Now, I'm going to give you a particular quiz in the laboratory, particularly on the topic number 2 on medication review. I hope you'll be able to answer this as part of your quiz for the laboratory. on a certain topic on Mrs. BC. And we'll be able to have this review, and you'll be able to develop a certain care plan for our patient, from day one until the last. So I think that's all for today. I'm Dr. Erwin Martinez Falier, your professor in San Pedro College, and also the visiting professor in Bournemouth University, United Kingdom. I hope everyone learned a lot on this topic on medication review. Thank you very much.